Hello everyone, this webinar will be going over the Attachment A work plan template for 2018-2019 ACORNS and CITE programs. We'll begin by going over the ACORNS work plan template, and then we'll finish up by going over the CITE. The two are very similar. We just wanted to show you the two documents. This is the first page. There's a glossary of terms for the work plan template. The first one is Policy, Systems, and Environmental, or PSE, program goal. The next is the long-term outcomes, your target population, estimated population reach, work plan objectives, activities, timeline, staff, short-term outcome and measures, and partnerships and resources. I highly recommend reading through each of these, and I'll discuss them a little bit as we go through this. They'll be helpful in helping understand what to put in what. The next page is where the work plan template begins. In this top section, please insert the name of your tribe or tribal organization, whoever is applying for the grant. In this first section, the PSE program goal number 1, this is where you will select which of the program focus areas the objective you will be putting in here focuses on. So for example, if I have planned program activities that are focused on improving physical activity, I would select the physical activity box, and then I would be inserting an objective that is supporting improving physical activity. If you're selecting more than one PSE program goal, you would insert all of the objectives that support the improving physical activity, and then if I was also increasing support for breastfeeding, I would go down to the next section and I would select increasing support for breastfeeding, and then I would insert my breastfeeding related objectives and activities underneath that one. So your objectives will be separated by your overarching PSE program goal. The next section is your long-term outcomes. This is what you hope to accomplish long-term with your goal, and will not necessarily be something that you will see accomplished by the end of this project year. Usually long-term outcomes take several years to go into effect, and it's a general vision or long-term goal that you have for your community related to wellness and how some of these activities are leading towards that long-term goal or outcome. The next section is target population. Your target population are the people who will be the main beneficiaries for your activities. So if I am working on worksite wellness, my target population will be all of the people that are a member of that worksite, so all of the employees of that office. So my target population would be the total number of employees. The second is estimated population reach. That would be your approximate guess or your estimate for how many of that target population you will reach with your program activities. So for example, if there are 50 people that work at my work site, and I think that my program will reach about 50% of those, then my estimated population reach would be 25. If you're doing a community-based intervention, meaning the activities you're proposing are for the entire community, your target population would be the population of your community. And then your estimated population reach would be your estimate of how many people within that community you will reach with your program activities. Another example is if you are focusing specifically on people who are elders in your community, you would insert at target population your total number of elders, and then under estimated population reach, you would estimate how many of those elders you think that your program will reach. So your target population will change based off of what your objective or your activity is. It's not necessarily your entire community. You will be able to define what that target population is, and that can change from project year to project year. So after you've completed who your target population is and what that estimated reach may be, you'll move on to your objective. Now, an objective is a measurable action which should be completed by the end of the project year. In the glossary, we talk about objectives being SMART. That stands for specific, measurable, attainable, relevant or realistic, and time-bound. So all of these will be time-bound because you're applying for a 1-year-long program. So all of your objectives should be completed by the end of the project year, which is September 29th, 2019. They should be specific and measurable, meaning that you would be able to look at that and say that it was completed or not. So if I wrote my objective as walking groups is not a measurable objective. That would be more of an activity. Maybe my objective would be to establish a walking group that meets monthly at my work site. So that would be a measurable objective because you know who it's reaching, you know how to measure if it's been completed or not, you know how to say if it's been done monthly or not, and it's very specific. What's really important about making your objective specific is that we know that there's a lot of staff turnover, so if you are taking over a work plan and the objectives and the activities are not specific or measurable, it's really hard to understand what you're trying to accomplish and by how much. So if I just wrote walking group, that means that I could potentially say I completed my objective by holding 1 walking group as opposed to holding consistent, sustained walking groups, which would actually have an impact on improving health in your community. So the objective should be SMART, measurable, and they should be directly related to supporting what your PSE program goal that you selected was. The next column is activities. So as you'll notice, you will likely have multiple activities outlined to complete an objective. So if my objective is to establish a weekly walking group at my work site, my activities are going to break down the step-by-step actions that I will need to take in order to accomplish that objective. So we know that it's going to take some dialogue or maybe some meetings with my worksite leadership. It's going to require conducting some outreach or creating some flyers. It's going to require identifying the staff that will be leading those walking groups. There will need to be some sort of measurement or tracking for walking group attendance, for maybe miles that you walked. So all of those different steps that you need to take in order to accomplish your objective, that goes into your activities column. And if you need more than 5 activities to complete your objective, feel free to add that. If you need less than that, feel free to leave some of those blank. The more detailed step-by-step you can create your work plan, the easier it is for you to follow and make sure that you're on track with meeting your program goals. The next column is timeline. The timeline should be indicated for each one of your activities. So if my walking group at my work site is my objective, and my first activity is to meet with leadership to get their support, my timeline for that should reflect on when do I plan on meeting with leadership. So likely it'll be early in the project year because you can't move on to the next activities unless you have leadership buy-in. So the timeline should be associated with each one of the activities of when you will begin and end or complete that activity. And this will then give you a good checkpoint and benchmarks for moving through the project year and making sure that you're staying on track with completing your activities, which then help you to complete your objectives. So the next column is staff. The staff, this may be the same for all of them, but really you want to look at each activity that you have outlined and identify who is the responsible staff for that activity. So maybe one person might be in charge of meeting with leadership and planning that or scheduling that meeting, but maybe a different staff member is responsible for creating the flyers or the outreach materials. So you'll go through and think about each activity that you have outlined and what staff or staffs will be responsible for completing that. This next column is short-term outcome and measure. So again, you're going to be doing these based off of every activity. So again, if my objective is to establish a weekly walking group at my work site, and my first activity is to meet with leadership, my short-term or outcome measure is going to be the product or the proof that I've completed that activity. And that we're working towards that objective. So these will be sort of benchmarks and data that shows that you're completing your activity, and then that data collectively will help lead you to knowing that you've met your objective. So for example, if this activity is meeting with leadership, perhaps my short-term outcome measure is meeting minutes from that leadership, or some feedback from leadership about whether or not they've approved that, or maybe it's a memo from leadership saying that they support that walking group. So every single activity, so if that next one is to create outreach flyers or schedules or newsletters, then the short-term outcome or measure to prove that that activity was completed, that might be copies of those flyers or copies of those monthly newsletters. So those are going to be actual products that are deliverables that prove that those activities have been completed. Then the last column here is partnerships and resources. So this is again, this will be done for each activity that you have outlined. These will be what partnerships and what community resources will you be using to help you complete that activity. So this is a good way to brainstorm kind of all of the players that might be involved, and also all of the resources that you might need and that you can draw upon in order to complete that activity. So maybe you know that there's somebody that's a really good graphic designer that you want to design your outreach flyers. So maybe you'll contact them as a resource or a partner. Or maybe some of the resources is that your office has InDesign or Adobe, and some really nice software that will help you design really high quality outreach materials. That could be a resource, a community resource that you list there. So this kind of helps give you a list of all of the items or the tools that you need in order to complete your activities. So each of these program goals usually require at least one or two objectives. And you don't want to design a program that is biting off more than you can chew, but you also don't want to design a program that is too simple and too easy. You want to be able to challenge yourself and help your community grow. So meet with your leadership and meet with your community team or your ACORNS team or the staff that will be involved, and go over this work plan with them together before you apply to make sure that everybody is on board with completing those objectives, and that they understand their responsibilities to help support the completion of those objectives and activities. And then also they can give you feedback on if they're realistic or not, and if they think that those would be things that you guys could complete within the project year. This work plan is one of the most important documents of the project. It will be your living it's a living document, meaning that you should be referring to this frequently to keep you and your project team on track with completing project objectives. And if you're ever going to report to your leadership about your progress, this is a great resource to bring in and say, these are our objectives, here are the activities we've outlined and the timeline that we've outlined, and we said we were going to have this done in the fall, we're on track, we've completed these things, and we're moving along according to plan. So it's a really important document, and the more time and detail you can put into this in the beginning, the more helpful it will be as you move through your project year and keeping things on task. So there's multiple tables here, so if you have other PSE program goals you want to select or work on, or if you have multiple objectives for that same PSE program goal, you can fill out as many as you need to use. If you need to add more, you're welcome to add more, and if you need to delete some lines, you're also welcome to delete some lines. We just tried to give you something to work with. So that's what the work plan looks like. This is the most heavily weighted piece of the application. So each of these sections has points associated with it. So really taking your time and doing a detailed job on that is important to make a competitive application. So we will briefly go over, that's the ACORNS one. We'll briefly take a look at the CITE one so you can see what that looks like. It's very similar. There's just a couple of differences. So this is the CITE work plan. It looks very similar other than there's the CITE logo here on the top. The other difference here with the CITE program is that we don't have the PSE program goal is already selected for you because CITE is only focused on commercial tobacco programs. So the PSE program goal is reduce communities' exposure to commercial tobacco products and secondhand smoke. That should be the overarching goal for every single CITE application. In addition to that, there are only 4 strategies in which you can try to accomplish that PSE program goal. So as a CITE applicant, you are required to select one or multiple of these program strategies in order to meet that goal. The first one is expand the reach of the CDC TIPS media campaign or other federal tobacco education campaigns, Surgeon General reports, and other tobacco-related science or evidence-based publications among tribal members. So that's focusing on doing media campaigns, education that's tobacco-related and can be distributed among tribal leaders and tribal members. The second strategy is inform tribal leaders, decision makers, and tribal communities about the burden of commercial tobacco use to their tribal members and tribal economy. So that's more about education of tribal leaders and decision makers about the risks and burden of commercial tobacco and how that can impact health and wellness as well as the economy. The third program strategy you can select from is implement evidence-based, culturally relevant interventions that increase the number of AINs protected from secondhand commercial tobacco smoke as a result of implementing commercial tobacco-free policies. So this strategy is based on implementing commercial tobacco-free policies in tribal offices, administration, housing, health centers, or within the community at large. The last one is implement evidence-based, culturally appropriate tribal interventions that decrease AIN exposure to commercial tobacco marketing and the availability of commercial tobacco products. So this strategy is focused on designing a project or a program that reduces the marketing of commercial tobacco and also reduces the availability of commercial tobacco products to your community. So you will select which one of these strategies you will be focused on, and then based off of what you select, you'll fill out target population the same, estimated population reach is the same. The objectives will be need to be smart and measurable and designed to support one of these program strategies. And then everything else on here is the same. So you'll fill out the objectives, activities, timeline, staff, short-term outcome measure, partnerships and resources, just like you would on the ACORNS work plan template. And again, there is a glossary at the top. Highly recommend you reading through those and making sure you feel familiar. And then, of course, you can reach out to program staff if you have any additional questions. So that completes the overview of the Attachment A for both CITE and ACORNS 2018-2019 work plan.